Dr. Wendy Coren has been an equestrian amateur all her life. She combined her love of horses and dogs with fitness and performance, becoming a chiropractor in 1980, and has been certified in multiple animal methodologies since 1998, including AVCA, American Veterinary Chiropractic. She developed Equaline with her husband and son in 2006.
Hello and welcome to Laser Therapy for the Senior Dog. I'm Dr. Wendy Coren, and before you listen to me, let me tell you a little bit about myself. I've been in practice since 1980 and working with canine companions and athletes since 1981. I've written numerous books, and particularly on canine mobility, and I lecture all over the world. And I'm honored to be here today to talk to you about how we can use low-level laser to enhance the life of your senior dog. First, to know a little bit about what laser therapy is. Another name for laser therapy is photomodulation. It creates a change on a cellular level from a beam of electromagnetic energy. Laser's an acronym, and what it actually stands for is light amplified by stimulated emission of radiation. And don't let that scare you. There is no dangerous radiation involved in your low-level laser. There's a difference between red light, LED light, and laser. And really, it's about the depth of penetration. The effectiveness is about absorption. How much of that light is absorbed into the cells and into the tissue? And a lot of that depends upon the frequency which that red light goes into the body in. Red light is most effective at the skin level. You'll see it in the human world for facial treatments and skin disorders and things like that. And it has some dramatic effectiveness in many studies. It reduces training fatigue. A 2011 study showed that at 660 nanometers, when combined with infrared, and we'll talk about that later, can delay the development of fatigue. It reduces inflammation. And you'll see in this presentation a number of examples of my own, and everything you'll see here has been done by me on clients of mine. So we're not going to use other people's experiences to discuss. We're going to talk about what I've done and what you can do with this low-level laser. It improves bone healing, and that's been demonstrated by ultrasound. It reduces pain, sometimes so quickly you won't even believe how fast you can touch somebody, some horse, some dog that has not even been touchable. It helps wound healing, and we've seen that so many times when there's just a puncture wound, and the low-level laser will allow that to heal from the inside out, giving you fast and infection-free results. On their own, the 630 to 660 red light is very beneficial. When you combine it with infrared in the 800 nanometer, you get outstanding results. And there's so many ways that you can do this yourself if you are treating your own pet, as well as if you're a professional doing this in your clinic. There are tools that decrease pain, and what you'll see there on the left was a little man who was immobile, unable to move forward. They carried him in, and it was one of the most outstanding locking up that I've ever experienced. And we used Revitavet red light therapy with varying frequencies, and he was running around in the afternoon. On the other side, you'll see a dog that has so much soreness in its back, has had many surgeries, has had radiation treatment, and literally when it sees someone coming at it to touch it, even with great intentions, all it wants to do is run for cover. And so we use the Revitavet red light therapy pre-treatment, and within minutes, sometimes 1 minute, the dog will then allow itself to be handled. Here we have a dog that was rescued after spending 3 years in a crate. His anxiety level is so high that it took everything we did to get him out from under the chair to get him towards me for me to be able to get my hands on him. But he wasn't comfortable, and never a good idea to do any kind of treatment on an animal when they're in that level of anxiety and fear based. So here we use the Revitavet red light therapy to calm him. And the end result was him enjoying his therapy, his enjoying his adjustment, and sitting on my lap for his post care. That was wonderful. Now, here's a fascinating 19-year-old Dachshund. Well, we're guessing because he was rescued as an adult and he's been around a long time. And when they brought him over, this is how he was moving. That was a pretty extreme level of discomfort. And in this case, we used a combination of infrared over the hips, over the spine, over every single segment, and then red light afterwards. And this was 10 minutes later. We had straight line walking. He was just about as comfortable. So when we're using this level of therapy, what we're finding is you don't have to wonder if it works. You're getting results in record time. Red light therapy is extremely effective for wound healing. So when your vet checks this and does therapy on it, whatever they do at home by using your red light pad or red light handheld device, you're able to improve the healing, decrease the infection, and prevent further infection by allowing healing to come from the inside out. As an at-home post-veterinary treatment, red light is one of the most effective ways to enhance your healing protocol. Not only that, we find that puncture wounds are very common, and getting that red light on right away allows the area to stay healthier and reduce the possibility of long-term infection. The laser light therapy devices, you have ones that emit the light with the ability to change your frequencies, and you have ones that are literally on off. They frequency modulate on their own, but the realm of therapy is strictly in that 640 nanometers, and we've used it on horses, dogs, humans, cats. We have not noticed that any of them resist the therapy at all. So this handsome man came for maintenance kind of care, just so that he can run faster and move better. And on the next slide, you'll see the before video with the after video. And we're going to start here with the during video. And what we did was a combination of infrared with a professional unit. And then we used the Revitavet red light. And the red light sequences and frequencies from my handheld unit are similar to what you can use in the handheld. So I'm going to show you the entire video as we did this in real time to give you a sense of what this treatment is like, and then how it can be followed up on home treatments with using either infrared or IR in a more user-friendly and easy-to-use battery-operated unit. Here you go. He's moving forward. Now let's look at how he was when he first came on this next slide. Let's take a look at the first one. Watch him move. And as he comes back to us, he is waddling and collapsing in on that left front. Watch him walk towards us now. One laser treatment. You may ask yourself, because, we've all heard about laser for years and years, and you may wonder, well, does it really work? How do I know? How do I trust that it really works? Well, as of 3 years ago, there were over 7,500 peer-review published studies on laser for large population conditions. And these studies have been collected over 50 years. 90% of the studies were using the red or the infrared lasers. The class 4 hot lasers are a whole nother subject that we're not going to cover today. Studies were performed on both humans and animals, and the cool part is that they found no documented side effects to laser or photobiomodulation therapy. And that can't be said for many, many things. If you look at the unit up here on the horse, we're using a pad, but it also has a battery-operated photomodulation ability to change from red light only, infrared light only, or together for both depth of penetration and surface treatments. And these are easily available. Laser therapy articles have concluded that laser decreases pain, decreases inflammation, decreases wound healing times, increases post-surgical recovery, regenerates peripheral nerves that have been damaged, potentiates central neurons, increases skin circulation and microcirculation, increases ATP production so you have more energy production by the cell, increases antioxidant activity, biomodulates the cell, and there is a great biological effect. So we can have a positive effect on organs, on tissues, and on systemic conditions that should be discussed with your veterinarian before you mess with that. Common conditions that may respond to laser therapy are acute pain and inflammation, chronic pain, arthritis, disc cartilage injuries, neuropathies, wounds, burns, fractures, and post-surgical healing. And as with any therapy, discuss the health of your pet with your vet, and then use this to accelerate and be a companion to the healing processes that they have suggested. The principles behind biomodulation and photobiomodulation is that there are specific proton acceptors for both infrared and red light therapy. And it predominantly happens in that 580 to 860 nanometer range. Your infrared lasers increase ATP, increase cellular signaling, and alter ROS. Red lights also increase ATP, and they have been known to affect the expression of genes so that you're actually getting full life potential. A combination has, in my experience, been the most successful way to use low-level laser. In a nutshell, it decreases inflammation, it decreases pain, and it accelerates healing. So, it's a good nutshell to be in. The difference between an LED and a laser, we like to say, is like the difference between a bicycle and a Lamborghini. You can get an effect from light. For LED lights are readily available. I have to admit, we call them cat toys, because coherent light, the laser light, has biological effects that, by understanding the frequencies, you can choose the effect you want, use the most efficient and effective therapy for what you are attempting to accomplish. So white light and monochromatic light have, as you can see on the top on the left, they have discordant and their beams go all over the place. But coherent light is targeted, and that's where you're going to get the best results possible. So this was an interesting case study because young Rudy, not a senior dog, but still relevant, had a seizure and was twitching, not really responsive, and brought to the veterinarian. And they did blood work at the time and found a low thyroid. Because I am in a world where everyone I know is in the veterinary field. My son is a veterinarian and acupuncturist. My good friends are all in the animal veterinary world. So I made some phone calls and we made the decision not to start on medication right away, to actually use laser acupuncture as a means of working with him over a few week period, and then we'd retest the blood and treat as necessary. If you can take your eyes onto the endocrinology study, we are talking about 4 weeks post seizure. The only therapy received was laser. And his results went from point 0.7 and in the low range and in the therapeutic range to completely mid-range normal, with the quote from the treating physician saying, after laser puncture was done, the patient is doing well. So by utilizing laser under supervision, you can get an amazing array of results that can absolutely add to the quality of life for your pet and or client. So let's talk about the picture on the left. When Sam came to see us for his first visit, we have a 13-year-old lab with a pronounced limp that has had quite a lot of veterinary care and not been able to resolve the discomfort. And they're wondering if it's a shortening of life, end of life kind of decision. What we noticed with the first one was that there was no spinal strength or muscular integrity, that there was a multiple curves throughout the top of the spine. And what we also noticed was that there is so much atrophy in the shoulder joint that there was no possible way that this dog could walk without limping. So our attempt was to use the laser to help increase cellular function at that shoulder area in the neck so that it affected the nerve supply to it and throughout the spine. Now, in this case, we did also do chiropractic. We did also use kinesiology taping to give Sam the best chance of enjoying his life. And you'll get a sense of where we are. We're in progress. And this is a message of hope. There's muscle development. We're sort of giving you a sneak peek at some of his adjusting that was going on. We've got a much straighter spine. We've got weight bearing on a limb that was non-weight bearing. So we're using combination therapies here, always protecting the owner handler with glasses on them as well when we're using the professional unit, not necessary when you're using the pad. And as you can see, there's no discomfort for the pet when they're receiving their laser therapy. So there you have it. Low-level laser is an appropriate choice for helping your pet, your client, yourself heal faster, reduce pain, and reduce anxiety. If you have any questions whatsoever, please visit equalign.com. It's EQUALIGN, and an appropriate choice for helping your pet, your client, yourself heal faster, reduce pain, and reduce anxiety. And feel free to follow me on social media at EquilineK9 on Instagram and on Facebook. I look forward to interacting with you. Best of luck with all of your health healing activities for yourself and your canine companion.